It's Friday, and you know what that means for Kababayan LA. We skipped this for about 2 weeks, but we are back once again today on the show. It's Fashion Friday. Get ready to meet a pair of young and talented designers. They make beautiful clothes, and not just that, they have a rich history that they can share with us this afternoon on the show. And also, they are going to bring their collection. They are going to be showcasing some of their pieces. I can't wait for that. They are really, really wonderful pieces that we would all want to wear. But before that, syempre, beautiful people today on the show. How to be beautiful. Ito naman po ang ating interview with a very renowned surgeon from the Philippines. Let's watch Dr. Charrie Ballecer. Dr. Charrie Ballecer, once again, welcome to Kababayan LA.
Hi, Janelle. Thank you for having me here.
Si Dr. Charrie po nanggaling sa Philippines. We met her before on the show 3 years ago.
Around 2 years
ago. And welcome back. And alam mo naman yung mga kababayan natin nagpupunta ng Pilipinas para magpa-beauty. Ano bang mga bagong treatments ngayon sa Pilipinas, especially sa clinic mo?
Okay, first the skin. Let's start with the skin, or we start with the second procedure that I wanted to discuss with you today.
Let's start with the skin. Sige.
Okay, we have this platelet-rich plasma. It's called the PRP. What is done is, let me go straight to the procedure.
Sige.
What is done is we get around 9 cc's of blood from the patient. It's an autologous treatment, which means I'm using the patient's blood.
Okay.
This is then centrifuged or subjected to a certain treatment. Then an activator is placed, and it's exactly the same plasma that we inject. Let's say if the patient needs fillers, if the patient needs some skin treatments for whitening, for anti-aging, for collagenization of the skin, for regeneration of tissues.
So basically for everything. Kung meron kang mga dark spots, kung meron kang problema sa wrinkles, this could be a procedure for you.
Yes, it is. It can be used as a non-invasive facelift. However, Janelle, this is not only used for the skin. It can be used for other conditions, like if you have a problem with your tendinitis, or for some muscle fasciitis, but this is not it's not my line.
Right.
But what we're talking about is it's not really something that you only use aesthetically.
Right.
You also use it for certain problems that happen.
Which I guess makes it more credible.
It is, yes.
Yeah. But what's the downtime?
Okay, the procedure takes 45 minutes. Downtime is practically none. You just become, a little pinkish on the skin, maybe for 1 or 2 days, but that's about it. It's nice because there's a rosy glow after.
And how long does it last? Hindi diba, yung iba sinasabi na, let's say Botox. Yung Botox, every so often you have to go, even liposuction, merong maintenance or something.
That's right.
But what about this one?
Okay, I normally would recommend it 6 weeks interval, after which maybe 2 or 3 treatments, depending on the patient's condition, and it would last for at least 18 months or so.
Oh, 18 months, and then babalik na lang ulit if they want more.
If they need more and they see the results,
right,
and they're happy with the results, and they can come back to me.
And who are the patients who should undergo? Anong mga sinabi mo na kanina, yung may wrinkles, may dark spots? What about the ones that can't undergo this procedure? Meron ba?
Okay, these are patients who are on anticoagulant therapy. These are patients.
Sino yung mga yun?
Well, these are patients taking anticoagulants, Coumadin, etc.
Okay.
Now, patients also who have acute and chronic systemic and metabolic disorders, those who have chronic liver pathology, those patients who are, alcohol or drug users, and those who have acute and chronic infection.
Bakit?
They're not a good. Well, they're immunocompromised, so it's best not to do that.
Not to just undergo the procedure. Okay.
And practically for other procedures as well, it's not recommended that they undergo it.
Okay, there's another procedure we have last 2 minutes on the show. Axillary hyperhidrosis. Ano yan?
You said it right. In short, that's excessive sweating.
Okay. Meron mga iba nagsusweat sa kamay, meron iba sa underarms, merong iba sa paa.
Yes.
So you can cure that?
We're talking about axillary or excessive sweating of the axilla, because it becomes a social problem to the patient.
Right.
My youngest patient is a 15-year-old girl. The parents brought her over to me because she was already she had an inferiority complex.
Right.
She would like just to isolate herself and stay in one side, because even inside a mall, napakalamig, she would start sweating and it would mark.
Ano ba yan? Hereditary ba yan? How does it develop?
No, there's just excessive sweating of the sweat glands. There's a part of the brain called the hypothalamus. nerves. It's the one that sends a sensory signal to the sweat nerves.
Right.
And the patient starts sweating.
Okay.
And you know, the problem about it is it does not happen during hot weather only. It happens under any external condition.
Okay. Ano ang procedure for this? Is it surgical?
Okay, there are several procedures. You can use antiperspirants. You can, if it doesn't work, you can use drugs. If it still doesn't work, then probably you try Botox, but it's very temporary.
And it's very painful now.
And it's painful, that's right. Or some would like to try endoscopic thoracic sympathectomy, which I do not like to recommend.
Right.
And finally, what I do, which is, the patient has to undergo some form of surgery. I either use the Ballecer on her or I do manual curettage of the sweat glands. And the results are beautiful.
Oh, okay.
With the least complications.
May downtime din ba dito?
Well, downtime, I remove 1 or 2 stitches after 5 days to 7 days. That's about it. And it's a covered area, so there's no problem. And the results that you get are, they will really outweigh the downtime.
Right. All right. Okay. We learn a lot every time we have Dr. Ballecer here on the show with us. If you want to get in touch with her, that's the number, that's the website on the screen. But for now, thank you so much. More power to you. We look forward to your next visit.
Thank you. And thank you for having me here once more. More power to you.
Thank you.
Thank you.
Marami pong uuwi sa Pilipinas, magbabakasyon, pupunta para sa eleksyon. You may want to visit Dr. Ballecer as well and make yourselves look prettier or more beautiful. When we return, Fashion Friday continues on Kababayan LA. Jewelry, clothes, and more clothes. Get ready to drool. Don't go away.
We walked into the store, saw the great selection.